Hey everybody, Dr. Vinod Somareddy here again today. I'd like to go over something about the shoulder today. And the question I get asked a lot in PT is, why can't I raise my arm all the way? People could raise their arm to here sometimes in rehab, and sometimes they can get it all the way up to here, but they just can't do it the way they used to do it. They can't get it all the way back here, and they can't reach back and touch the back of their shoulder. They can't reach back and do this. It's a restricting, and it's a big problem. People need to be able to reach out and touch things, right? They need to use their arms. So the first thing is pretty obvious. You have muscle weakness, right? From injuries, from restriction in motion, from a fall. People get muscle restrictions in their rotator cuff muscles, their neck muscles, there's muscles right over here, which are called your scapular muscles, which are a little lower serratus anterior, and associated scapular muscles, and the muscles in your back that support your wing bone, which is called your scapula. These muscles over time get weak, and if you don't use them, you lose them. So oftentimes muscle weakness comes into play, and people just can't get the right exercise to get stronger, and they wait too long. So that's pretty obvious. The second one is ligament restriction. You have ligaments in the shoulder that support your shoulder. Your shoulder is a ball and socket joint. Basically means that the ball of your shoulder sits into a socket. And when that socket just hangs, there's ligaments around the joint that help support so your shoulder just doesn't go like this. There's also muscles around the ligaments, outside of the ligaments, that help keep the shoulder in the same spot. But more importantly, the muscles are there to help move. The ligaments are there to support and stabilize. So when you have ligaments that are tight because of a potential problem, an injury, a neurological condition, or a lack of utilization, the ligaments get tight, you can't move the shoulder as fluidly, and you lose that motion. Nerve restrictions are nerve dysfunctions. People have heard different issues with hurting their shoulders and their arms, even from surgery potentially. They have restrictions in their arm because of tightness in their nerves. You could also have a nerve that's being caught up in your neck, and that can create a weakness and a lack of motion in your shoulder. We've seen that with people who have potentially a tear, which is not on here, but a potential tear of the shoulder joint. And basically what ends up happening is the nerves get really tense and tight in their neck, and they get like a pain that might refer down their arm. And these pains and these restrictions can be elicited by the nerve either being caught up in your neck, potentially over here in your scalenes, even through this area of your neck right through here, and even down into your arm. You could find that it goes way down into your arm and you get a significant restriction and you can't do very much about it. So, well, you can do something about it, but at that moment in time you feel like you can't, and you need to see a therapist or you need to see somebody who can help you with that. So those things kind of get in the way of restriction of your shoulder, and you don't really know what to do sometimes. The last thing, and one of the most common things I see in the clinic, is muscle imbalances. You find that certain muscles in your arm move more, or certain joints in your shoulder, so they move. One moves more than the other. So your right move more than your left. My example is that if I can raise this up pretty good up to there, but on the right side it is restricted. It's definitely restricted. I could push it a little bit and get up there, but I do feel a little discomfort in my arm, and that's because I have muscle imbalances. I played baseball for a long time. I threw my heart out, so I didn't rehab it as well as I should, and I created some restrictions in muscles in my arm, and you can see the restriction there, right? So certain muscles, there are muscles in the back, there's muscles in the front, there's muscles up top, and there are muscles underneath your shoulder. And these muscles get tight, some of them get elongated and overstretched, and some of them get weak, and some of them get really strong to support. For example, the trapezius muscle, oftentimes people will say, yeah, my trapezius muscle, this muscle right here is always tight. It's working so hard because the muscles down here and the muscles over here are not supporting everything. So you have this muscle that's working really hard to keep everything stabilized, and that attaches to your neck as well. And then your neck, of course, they have muscles. Then you have your neck muscles that help support your shoulder and vice versa, and they can get tight as well. So muscle imbalances, a big player in the shoulder and why you can't raise your arm up all the way. If you don't have these three things, or a fracture or something that's obviously a medical condition, you should take a look at